President.
The senator from New Hampshire.
Madam President, I come to the floor to join my colleagues in opposing this misguided measure, which would leave millions of women and families with fewer health care options, and it would drastically decrease women's access to basic primary and preventive health services, including life-saving cancer screenings and HIV testing. But let's make no mistake about it, as my colleagues have said, the primary target of this legislation is Planned Parenthood. For years now, we've seen Republican leaders in Congress attempt to defund this essential health care provider, which serves millions of women nationwide, including nearly 12,000 women in New Hampshire, most of them with incomes below or near the poverty line. And the sad irony of these attacks is that study after study has shown that restricting access to birth control and other family planning methods actually increases the number of abortions. The Guttmacher Institute estimates that in 2014 alone, contraceptive care provided under Title X helped women avert more than 900,000 unintended pregnancies and 326,000 abortions. Without contraceptive care provided by Title X funded centers, the U.S. rates of unintended pregnancy and preventable abortions would be an estimated 33% higher, and the teen pregnancy rate would be 30% higher. At the end of the Obama administration, teen pregnancy in the United States was at its lowest point since we've been keeping track. And as Senator Hirono said, these services don't provide abortions. Federal law expressly forbids the use of federal funds to pay for abortion except to save the life of the mother. So the real issue here is not about abortion. This is about ensuring that American women have access to the basic health care they need where they want to receive it. This is just a mean-spirited effort to keep women from seeing the provider they want to see and getting care at rates they can afford. For 40% of women, their visit to a family planning center is the only care they receive annually. In 2015 alone, Title X provided basic primary and preventive health care services such as Pap tests, breast exams, birth control, and HIV testing to more than 4 million women and men at nearly 4,000 health centers. Planned Parenthood plays an essentially important role in delivering health services to low-income, uninsured, and vulnerable individuals, including in rural areas. Now, I'm sure that every person in this chamber has received letters and emails and phone calls from constituents on this issue. They're pleading with us, don't take away our access to health care from Planned Parenthood. I received a letter from Sandra Shonichson of Goshen, New Hampshire, and she writes, Planned Parenthood was my only affordable source of gynecological health care for most of my life. I received good, wise, and thoughtful care. I think it's not extreme to say they saved my life. Abortions were not involved. They, meaning Planned Parenthood, remain very important, especially for poor or uninsured women. There are not enough alternate low-cost women's clinics available. Not providing birth control services to women who want it is not a good economic or social solution. Don't let it be defunded. And in a follow-up call, Sandra said that without Planned Parenthood, she would not have had any health care at all. Because her mother died of breast cancer, Sandra is deeply grateful that she's been able to receive mammograms thanks to Planned Parenthood. I also heard from Meredith Murray of Exeter, New Hampshire. She says, 9 years ago, I graduated from college and immediately began my journey to become a medical provider. During this time in my life, I was surviving almost entirely on student loans, and I knew that during this time especially, I needed to ensure that I was doing all I could to prevent pregnancy. With my insurance, an IUD would have cost $900. That was not possible for me to afford. Then I remembered Planned Parenthood. I was informed due to Title X funding, my IUD would be completely covered. And I continued to use Planned Parenthood services for the next 5 years for my routine screenings while in medical school. The care I received was phenomenal. As I proceeded through my medical training, I strived to be as kind, compassionate, and knowledgeable as those who work Planned Parenthood health centers. I'm now a practicing medical provider, married and still using an IUD because Planned Parenthood offered me that opportunity. And I received this letter from Samantha Fox of Bow, New Hampshire. She writes that in 2017, I was a 19-year-old just barely starting out when I was denied health insurance due to a pre-existing condition. Had I been able to access affordable coverage, my pre-existing condition, a reproductive system disorder, would have been easily manageable. At that time, I was able to access care through Planned Parenthood, which likely preserved my ability to conceive in the future. And finally, let me share this message from Rabina Paris of Rye, New Hampshire. She says, I started utilizing the services at Planned Parenthood for birth control when I was about 17 years old. Planned Parenthood made sure I was protected and healthy. They gave me access to vital protection and health care when I couldn't get it anywhere else. They regularly called me with reminders to have exams and to pick up my prescription. Planned Parenthood is the reason my husband and I were able to graduate from high school and college. I'm not sure what our lives would be like now without their support. No, I don't know. Do the people who are voting for the CRA believe it would be better to have allowed the people who I just talked about to prohibit them access to these health care services so that their lives would have been disrupted, so that they might not have finished college, so we wouldn't have another doctor in the world, so that they wouldn't be able to afford health care? I hope we will listen to our constituents who have been speaking out in passionate support of Planned Parenthood and other family planning clinics. This is about respecting women's access to health care services, including millions of vulnerable women who have nowhere else to turn for essential care. And this is also about respecting women's constitutionally protected right to make our own reproductive choices. We must not allow Congress to strip away investments in family planning clinics by allowing states to discriminate. And finally, I just want to point out that we haven't heard from any of our colleagues on the other side of the aisle who are voting for this measure about why they think it's so critical. I don't know, maybe they're not willing to come to the floor and tell my constituents why they should be denied access to health care from the provider they want. Well, I'm disappointed that we haven't heard from anyone who's willing to stand up and defend this vote. Well, I hope they're going to have to defend it to the American people. Thank you, Madam President, and I yield the floor.